Namaste. Myself Dr. Anita Tripathi, Senior Consultant Pediatrician in MEDICOVER Hospital for Women and Child, Visakhapatnam. So today I'll be speaking about precautions to be taken during the summer. We know like our place is one of the hottest in the country, and our country presently is one of the hottest in the planet, and this is going to continue for the next 2 to 3 weeks. So what precautions shall we take? Okay, I'm going to tell you, be indoors, don't come out during the peak summer time, that is during 10 to 4. But can we stay indoors? We are all like outside. So what are we going to do? Of course, small children, ladies who don't have it's not necessary to come out, or the schools are closed now. So better stay indoors. But when we move out, be very careful regarding the travel. If you are moving in a four-wheeler, it's fine. If it is air conditioned, it's fine. But supposingly in an AC car, you are stopping the car, you are parking the car for some time. It's going to be 10-15 minutes. The car is the place where it's going to be very hot. The temperature rises very fast, and it's not advisable to sit inside the vehicle for a long time. So avoid that. Secondly, when you travel out, always carry a wet towel, especially if you are traveling out with a kid, small child. A towel which is wet, especially in cold water, carry always with you, so that intermittently you can put over the head and also the limbs, the neck, the back, okay, especially your child. And this will cool the body. We know that evaporation causes cooling, and further you are going to wipe off the sweat also. Carry a water bottle always, and you can also carry, if it's for a long time, some cut fruits. Watermelon is easily available nowadays, and salads. Cucumber is the best. Then ORS, WHO certified ORS sachets, if you can get and carry in a big bottle of 1 liter water. Add that, see the carton, it's written there with how much quantity you have to mix the ORS. So accordingly you can carry with you. Then clothing, the dresses are so important. You have to wear especially cotton, light colored, loose, breathable dresses. With that, if you are going to wear dark colored, it's going to absorb the sun heat, and tight or synthetic clothing, it's going to be unbreathable. You are going to perspire more, sweat more. Then you have to carry with you either a hat or an umbrella if you are walking. Then what you are going to do to avoid the glare of the sun, the ultraviolet rays, which are harmful for the skin and also your eyes. So use dark glasses, and you have to use a sunscreen lotion, especially for a child also you can use if your baby is more than 10 months or 12 months of age. And next thing is what you are going to do, like supposing your child is crying, is feeling thirsty, is feeling restless, cranky, can't speak. Some children, they usually don't speak. 1 year child, 1.5 years. So you cannot know whether your child is thirsty, dehydrated, why your child is cranky. So for such children, you have to observe for heat exhaustion, dehydration. So these are the symptoms. Along with that, when your child cries, there won't be any tears also coming out. The skin, if you pinch, this won't fall back also. The skin will remain loose. Then the body temperature also, sometimes it may be warm, sometimes it can be normal or cold with a fast breathing, and the diapers won't become wet also, and the child will not pass urine. So these are the symptoms of heat exhaustion. So immediately you have to see and give water to your child, and as I said, cool your child. Then what you have to take care to avoid infections. Sometimes we send children now to summer camps. There are swimming classes and other things. Okay, you can send them, but always try to avoid ear infections and dehydration, and also apply lotions to the body. The skin, sometimes skin rashes, they happen. There occurs atopy, eczema, the skin becomes dry. So take care of the skin, take care of the eyes, take care of the ears. Avoid very hot, spicy and oily food. The nutrition should be taken care of. If you take this, the gut immunity will be lost, there will be infections, we cannot digest, and if there is loose motion, vomiting along with heat exhaustion, this will lead to further dehydration. Now coming down to heat stroke. When to reach the doctor? These are the remedies we can take care when we are at home amongst us. But if your child becomes suddenly very loose, very drowsy and sometimes disoriented, sometimes the child's temperature shoots up. Don't take it like every fever is viral fever or infection. It can be a symptom of heat stroke. Our brain contains a heat thermoregulatory system that won't function due to the high fever, due to the temperature. So the temperature may shoot to 104 degree Fahrenheit. You don't know how to manage. The child may vomit, and sometimes there may be blood in the vomiting. So for such cases, you have to rush to the hospital. There may be throwing seizures, fits. So this requires hospitalization, IV fluids, cooling the body and taking other care. So please take care during the hot scorching summer. Don't go for heat strokes. We can fight the summer at home, at school, at colleges, at our working places. Please take care. Thank you.